Hi, Tim Morrison again with the Ovarian Cancer Connection. I'm with Cumulus Broadcasting 93.5. Now Joan Dreswicki is with the Ovarian Cancer Connection. And now Joan, you're a survivor.
I am.
And
Yes.
I wonder if you can maybe talk to the folks that are watching today about some of the symptoms, what to look for. And especially you being a survivor, you know exactly firsthand
That's right.
what to look for.
I was diagnosed in 2006, and I, in retrospect, had the classic symptoms: the bloating, right abdominal pain, or you have abdominal pain in your whole area, frequency of urination. I had fatigue, not just tiredness, just fatigue, and I had difficulty eating, keeping things down, and I had upset stomach, and that's another one of the signs. It was just draining, very, very draining. So I had these symptoms increased, and I went to the emergency room at the hospital. They admitted me, and they did all kinds of tests on me. They could not find anything wrong. I had gallbladder tests, kidney function tests. They thought I had gallbladder problems, rotavirus, norovirus, other types of problems.
And they hadn't done the CA-125 yet?
No, they had not.
Okay.
They had not done that at all. And then they brought in a surgeon, and my ovarian cancer was found on exploratory surgery. And, you know, it was just very devastating to hear.
Sure.
But with the symptoms, I can't emphasize this enough for women to be aware of that and be strong advocates for themselves. Now, they do mimic other diseases, but if they do last 2 weeks or more, please see your physician. You know what's going on with your body. And gentlemen, please know the signs and symptoms so you play a significant role in this, knowing the symptoms, to have your spouse, your daughter, your sister, your significant other get into the doctor and have it checked out. As I said, if they last 2 or more weeks, it is very, very important. And if you can get diagnosed early, if there's a problem, it increases survival rate.
With most ovarian cancers, it does. If you can catch it in
Yes.
an earlier phase, as with
That's
most cancers in general, the
Yes.
earlier you catch it, the better your chance of survival.
Exactly.
There are some strains of cancer. I know my wife was diagnosed in 2005,
Yes.
and it was a very virulent, fast-growing strain of cancer, and it didn't really matter what stage they caught it in. Now, have you had follow-up treatment since?
I've had follow-up treatment. I had intensive chemotherapy because my tumor was on my right ovary attached to my intestines. But I've had follow-up chemotherapy, kind of rough, but you know, you go through that.
Sure.
And I had no recurrences, thank God. You know, I've
Yes.
been very, very fortunate, very blessed. So that's why I feel compelled to speak out about this. As Katy Perry sings, you're going to hear me roar about the fight for ovarian cancer.
Oh, good.
It's-
Joan Dreswicki, and Joan, you mentioned believe, you mentioned faith, and I can't imagine going down the road of cancer without faith in your life. It'd just be, I think it would be torturous. But know that there is hope, that there's, you know, despite, my wife was given 6 months to live, and, you know, despite hearing the doom and gloom, she is now 10 years
Yes.
cancer-free.
Wonderful.
And the CA-125 number, Joan and I were talking about, 15 to 30 is considered normal.
That's
All of
right.
us are fighting cancer every day. It's cells that are reproducing. Now, we have cells in our mouth and esophagus and our bone marrow that are reproducing, which are the good ones. And then the
That's
bad
right.
ones is the cancer.
That's right.
But her last CA-125, it was in the thousands right after her surgery. And her last checkup with Dr. Phibbs locally, her number was 4. So praise God.
That's
And
right.
you know that there's help, and know that there are survivors like Joan Dreswicki and others, my wife and others. So if you hear the worst news possible, don't take it to heart. You know,
That's
and
right.
and gals, if you can take this to heart, what Joan is talking about, any of these symptoms, anything out of the ordinary, call your doctor.
That's right. And I do want to emphasize that a pap smear does not find ovarian cancer. There are some tests, the CA-125, MRI, CAT scan, but right now there is no definitive testing. But there is research going on with this, and we are advocating for a definitive test for
Right.
this. And also there are some risk factors too. Undecided fertility, a history of breast, colon, and ovarian cancer, a personal history or a family history also. And also increasing age, although we're seeing some younger women with ovarian now.
If you go to the walk, the ovarian cancer walk that we have in September, it's it's so heart-wrenching to see so many young gals today that
That's
are
right.
that
That's
are
right.
wearing the ribbons and doing the survivor walk. But thank you so much for your time, and I hope people, if you've plugged in on this video and you've listened at all, chances are that ovarian cancer has maybe touched your life, and that if not, please listen to your body and listen to what Joan was talking about with the symptoms.
And
pick the phone up.
That's right, and if you're not sure, call the Ovarian Cancer Connection at 419-866-6622 and talk with someone. I have this, I don't know what to do, should I go to the doctor? We will try and help you and guide you along and be strong advocates for yourselves.
Wonderful suggestion, and they do so much as far as support in the background too as well. If you are on that journey with ovarian cancer, reach out to them. They can help in so many different ways. Joan Dreswicki, a survivor here in Northwest Ohio, with us on the Ovarian Cancer Connection.
Thank
Thanks,
you
Joan.
so much,
Thank
Jim.
you. Thank you.
You're welcome.